Ever been told your cholesterol's high, or maybe your triglycerides are a little too elevated? Here's the thing. You might feel completely fine, but high cholesterol is one of the biggest silent threats to your heart and brain health. This video is all about hyperlipidemia. What causes it, what the lab numbers mean, how to treat it, and yes, the medications doctors actually prescribe, including the starting doses. Let's dive in. First, this is for educational purposes only, not medical advice. Always talk to your doctor. So, what is hyperlipidemia? It means there's too much fat in your bloodstream, especially low-density lipoprotein, or LDL, known as the bad cholesterol, high-density lipoprotein, or HDL, the good one, and triglycerides, another kind of fat linked to heart and pancreas problems. Too much of the wrong fats? You're looking at blocked arteries, heart attacks, and strokes. Causes? Sometimes it's genetic, but more often it comes from a high-fat, high-sugar diet, lack of physical activity, diabetes, or thyroid disease, certain medications, alcohol use, or chronic kidney or liver conditions. Symptoms? Usually there aren't any, but in rare cases, you might notice yellow bumps on your skin called xanthomas, fat deposits around the eyes called xanthelasma, or a gray-white ring around the cornea. Sometimes, the first symptom is a heart attack. That's why screening matters. A lipid panel gives you 4 key numbers. LDL should be under 100. HDL should be over 40 for men and over 50 for women. Triglycerides should be under 150. And total cholesterol? Under 200. Doctors might also use risk calculators or coronary calcium scans to help guide treatment decisions. Let's talk about treatment. Step 1 is lifestyle. It's powerful. Eat more fiber and avoid saturated and trans fats. Get at least 150 minutes of movement every week. Lose excess weight, quit smoking, and reduce alcohol intake. If that's not enough, we move on to medications. Here's a complete breakdown with doses. Statins are the gold standard for lowering LDL and preventing heart attacks. Atorvastatin starts at 10 to 20 milligrams once daily. Rosuvastatin, 5 to 10 milligrams once daily. Simvastatin, also 10 to 20 milligrams once daily. These reduce cholesterol made by the liver. Common side effects? Muscle aches and, in rare cases, liver issues. Next up, Ezetimibe. It blocks cholesterol absorption in your intestines. Starting dose, 10 milligrams once daily. Then we have PCSK9 inhibitors. These are injectable meds that dramatically reduce LDL. Avelumab, 140 milligrams every 2 weeks. Alirocumab, 75 to 150 milligrams every 2 weeks. They're often used for genetic cholesterol disorders or statin intolerance. Fibrates are great for high triglycerides. Fenofibrate, 48 to 145 milligrams daily. Gemfibrozil, 600 milligrams twice daily. These help prevent pancreatitis in people with very high triglycerides. Next, prescription omega-3 fatty acids. Icosapent ethyl, 2 grams twice daily. They lower triglycerides and reduce inflammation and heart risk. Bile acid sequestrants bind cholesterol in the gut. Cholestyramine, 4 grams once or twice a day. They can raise triglycerides and sometimes cause bloating or constipation. Niacin, also called vitamin B3, improves all lipid numbers. Start at 500 milligrams at bedtime. It may cause flushing and changes in liver enzymes. After starting any medication, doctors usually recheck your cholesterol in 4 to 12 weeks. Then, every 3 to 12 months, they may monitor your liver, muscle enzymes, and triglycerides too. Now, let's look at some new and future treatments. Inclisiran is a small interfering RNA injection that targets PCSK9. It's given every 6 months. Bempedoic acid is a daily pill, ideal for people who can't tolerate statins. And gene therapy is on the horizon, still experimental, but promising for inherited cholesterol conditions. Here's a quick summary. LDL, or bad cholesterol, target under 100. Treat with statins, Ezetimibe, or PCSK9 inhibitors. HDL, the good cholesterol. Keep it above 40 for men, 50 for women. Main fix, lifestyle. Triglycerides, target under 150. Treat with fibrates, omega-3s, or niacin. Final thought, you can't feel high cholesterol, but your arteries do. Early testing, smart habits, and the right meds can prevent heart disease before it starts. You've got one heart. Take care of it now, not after your first heart attack. No cholesterol. Heart health, hyperlipidemia, preventative medicine, triglycerides, Dr. TikTok, medical education, how to learn medicine.